Wing Kwong, ManVsProstate. Just want to highlight the IBPSS and some of its limitations, right? So here is a 68-year-old coming in for an evaluation for male leolar urinary tract symptoms attributed to BPH. And we see an elevated voiding subscore consistent with stage 1 BPO. We see an elevated storage subscore associated with stage 2 OAB. And in this scenario, his total scores are 24, and he does not report any stage 3 urgency incontinence or history of retention stage 4. But it's really important to find that right blend for your clinic and for your clinical care, where it's not just this type of qualitative, subjective assessment, but also quantitative data. So, for example, a post-void residual. And you can see here his PVR is 229 cc's. This is a gentleman that we have concern for that potentially he has a hypocontractile bladder or evolving into Detrusor Underactivity stage 5. Remember, this is a communication tool. The transitions between each stages are not distinct. Stages can be skipped and stages can coexist. So just trying to understand how we use the IBPSS as a communication tool to identify men who have bladders at risk for dysfunction and for men who would need further evaluation with a bladder health baseline. So for example, in this situation, he meets two criteria. His total score is 8 or above. His is actually 24. In addition, he has a post-void residual of 229, which is greater than 100 cc's, which is what our cutoff is for the ManVsProstate triangle of triage that prompts or triggers a bladder health baseline with a minimum of cystoscopy up to a maximum of anything such as multi-channel urodynamics, a penile cuff test, whatever is most available in your healthcare system. So I hope that helps, and we'll talk more in the next one. All right, bye.